shaders. In the next few minutes, I would like to talk on Sjogren syndrome. So don't think that is not a very rare disease. This is a very common disease, but most of the times we miss the diagnosis. It's a late onset, a chronic, systemic, autoimmune, characterized by the lymphocytic infiltration and destruction of the salivary and the lacrimal glands. So dry eyes, dry mouth, resulting in the dry mouth, that is xerostomia, and the dryness and atrophy of the conjunctiva and the cornea, that is keratoconjunctivitis sicca. Okay. So first described by a Swedish ophthalmologist, Henrik Sjogren. So it's a late onset, a chronic systemic inflammatory autoimmune disease. So characterized by the lymphocytic infiltration in which glands? Salivary and the lacrimal glands, causing the dry mouth and the dry eyes. Very simple. Lymphocytic infiltration in the lacrimal and the salivary glands, causing xerostomia and xerophthalmia. It's an immune-mediated inflammation, so it's an immunological disorder. Salivary, lacrimal, sometimes the sweat glands, as the Sicca syndrome, or with internal organ involvement. So this is the sometimes not only the dry eyes and the dry mouth, sometimes internal organ involvement is also there. What are the internal organs involved in any rheumatology? Yes, kidneys could be involved, the gut may be involved, your heart may be involved, the brain may be involved. So all this, that is the reason rheumatology is purely a physician's disease. Okay, immunological disorders, chronic disorders, inflammatory disorders, and systemic disorders. Primary systemic sclerosis alone, secondary systemic sclerosis, associated underlying connective tissue disorders. So sometimes Sjogren's, it presents alone, that is your primary Sjogren's, sometimes the secondary Sjogren's. Secondary Sjogren's means you are treating a case of rheumatoid arthritis. These people will also have the dry mouth and the dry eyes. So that means associated Sjogren's. So the primary rheumatoid arthritis, associated Sjogren's. In the same way, lupus and scleroderma, systemic sclerosis, etc. Sicca syndrome, xerophthalmia and xerostomia, plus internal organ involvement and bone involvement. So these are the three types of your Sjogren's: primary Sjogren's, secondary Sjogren's, Sicca. See, as I told you that most of these inflammatory disorders, immunological disorders, are more common in the females, except your ankylosing spondylitis, very common in the males. Gouty arthritis, again common in the males, and psoriatic arthritis, equal, 50-50. But other diseases are more common in females. See, the late onset is the 4th or 5th or the 6th decade, not in the young individuals, unlike your rheumatoid arthritis or the lupus. Autoimmune, yes, HLA-B8, HLA-DR3, although DR4 is more closely associated with the syndrome occurring with the Raynaud's phenomenon. Antibodies to the Rho antigen occur in excess in relatives of the patients with the Sjogren syndrome. So when you get the autoimmune profile, so here the Rho antigen will be positive. Not only in the patient, if you check the blood of the other family members, so asymptomatic RO positive may be there in some individuals. Pathogens is believed to be the multifactorial. Here you have to blame the genes and the environmental factors. Known to be an autoimmune, but studies suggest that the disease process as genetic and environmental. So your Epstein-Barr virus, okay, HCV, and hormonal associated with the high prevalence in the women, especially the estrogen, etc. See the environmental factors, activation of your granular cells, HLA-DR independent immune systems that is genetically more prone. So then there will be the vascular endothelium, and this causes the infiltration of the gland by the lymphocytes, and then the activation of the lymphocytes within the gland leading to the cell destruction, cytokines, autoantibodies, and then the impaired secretion due to the glandular dysfunction. That's how they happen. So both the genetics and the environments, that finally they cause the lymphocytic infiltration and the tissue damage and pro-inflammatory cytokines and finally death of the cells and leading to the autoimmune disease. So here the autoantibodies of the your importance here in Sjogren's is the Rho antibodies, lymphocyte and the plasma cell infiltrations, connective tissue proliferations, glandular cell apoptosis, atrophy of the glandular structures in the affected tissues, so salivary or sebaceous or sweat glands, and secondary changes in the edema of the conjunctiva, redness of the eyes, watering of the eyes, gritty sensation in the eyes, etc. See here, the glandular inflammation. So the dry mouth is due to the decreased production of the saliva by the salivary glands. Dry and the fissured tongue, crackled, peeling and atrophic appearance of the lips. So it should be almost like a spotters for you to diagnose the dry mouth. See the teeth, caries teeth and early loss. So because of the dryness of the mouth, because of the less and less saliva. So the saliva is protective for our teeth. So as there is no saliva, the teeth will become decayed. So caries teeth. See how bad they are. So it's all because of the Sjogren syndrome. Chronic oral candidiasis is also frequent. Parotid gland enlargement. See the beautiful parotid gland enlargement here. Very common in alcoholics. Lacrimal gland involvement. Okay. See the lacrimal gland involvement. Dryness of the eyes causes the keratoconjunctival sicca. Burning, itchy sensation, gritty sensation, foreign body sensation in the eyes. Skin manifestations, xeroderma, pruritus and scaling. So because the sweat glands involvement here. There salivary glands, lacrimal glands, in the skin, sweat glands. Again the reduced secretions leads to the pruritus and the scaling, dry skin. Annular erythema, papillary erythema, including the sweets like lesions. Raynaud's syndrome, hyperglobulinic purpura, vitiligo, sweating abnormalities, cutaneous amyloidosis, alopecia, etc. Other manifestations, joint diseases. So as it is a systemic disease, autoimmune disease, not only those three joints, three areas, your mouth, eyes and the skin, but also the internal organs and the arthralgias and arthritis, myalgias and myositis, sinusitis, hearing loss, GERD, interstitial pneumonitis, pulmonary fibrosis, pulmonary hypertension, interstitial nephritis, RTA, migraine, different neuropathies, cerebral vasculitis. See so simple the disease, Sjogren's, dry eyes and the dry mouth. But if you neglect the disease, if it aggravates, it involves almost all the organs in the body. See the neurological involvement, nephrological involvement, okay, respiratory involvement, gastrointestinal involvement. So that is the reason. So don't underestimate any rheumatological condition. What are the associations for secondary Sjogren's? So already told you the several diseases are also the Sjogren's. Maybe rheumatoid arthritis is so common in the society. Lupus, nowadays we are seeing more and more cases. Scleroderma, yes, gastrointestinal motility disorders, mixed and connective tissue disorders, primary biliary cirrhosis, myositis, vasculitis, your large cell vasculitis, large vessel vasculitis, medium vessel, small vessel. So I will tell you exclusive class and vasculitis at a later date. Thyroiditis, your Hashimoto's thyroiditis, chronic active hepatitis, okay, and mixed cryoglobulinemia. All these diseases can be mixed with Sjogren's. So Sjogren's could be an associated finding in these diseases. So the diagnosis, both primary and the secondary, have the marked hypergamma globulinemia. So IgG more than the IgA or more than IgM. ANA may be positive, not all ANAs positives are not the lupus. Okay. So ANA could be positive even in the Sjogren's also, even the normal individuals also, 5 to 10% of the population. Normal people also will have a ANA positivity. Elevated the total protein and the sedimentation rates. Anti-Rho and anti-LA occur in approximately 60% of the patients with the Sjogren syndrome. Histology of the skin shows an absence of the sebaceous glands and decrease in the sweat glands. See the biopsy of the labial salivary glands, lymphocytic and the plasma cell infiltrates. These are all the cells. A lot of the cells are there. They are all the lymphocytes and the plasma cells. Skimmer's test. So this is a very important test to be done in the Sjogren's disease. So again, a German ophthalmologist, Schimmer, he determines whether the eye produces enough tears to keep it moist or not. So this test is used when a person experiences very dry eyes or excessive watering of the eyes. He places a small strip of the filter paper inside the lower eyelids, conjunctival sac. The eyes are closed for 5 minutes. See how the test is done. So put the strip and then close the eyes for about 5 minutes. The paper is then removed and the amount of the moisture is measured. This technique measures the basic tear function. Young person normally moistens 15 mm of the each paper strip. Because hypolacrimation occurs with aging, 33% of the normal elderly persons may wet only 10 mm in the 5 minutes. Persons with Sjogren's moist less than the 5 mm in the 5 minutes. That is the diagnostic. So less than 5 mm in 5 minutes is the diagnostic of your Sjogren's. Usually 15 mm will be there for the normal individuals. So the wetting of about the 15 mm will be there. In elderly population, maybe the 10 mm, because as age increases, the tears production may be reduced. That is the reason they use the tears drops. Okay, but in the Sjogren's, there will be less than the 5 mm wetting in 5 minutes. So the normal, more than the 15 mm wetting of the paper after the 5 minutes. Mild, 14 to 9. Moderate, 4 to 8. And severe, less than the 4. See the strip there, Skimmer's test strip. So they have given the numbers also. So this is how they do the Skimmer's test, Sjogren's. This is a rose Bengal dye, purple rose Bengal staining. The white of the eye normally should not take up any stain. Even though there is no deficiency of the tear production, the eye is dry because the tear film. Revised classification criteria. Ocular symptoms, at least one of the dry eyes for more than the 3 months. Sensation of the sand or the gravel in the eyes. Need for the tear substitutes more than the 3 times a day. More than the 3 times a day, they use these oxycellulose eye drops. Okay. Tears brand name is the tear eye drops. So oral symptoms, at least dry mouth for more than the 3 months. Here the 3 months. Dry mouth or the dry eyes, more than the 3 months. Recurrent or persistently swollen the salivary glands. Need the liquids to swallow the dry food. Ocular signs, at least one of the following 2 tests, Skimmer's test or Rose Bengal score. Histopathology, salivary glands, focal lymphocytic, sialidohydenitis. Salivary gland involvement, a positive result for at least one of the following diagnostic tests. Unstimulated whole salivary flow, very less. Parotid salivography shows the punctate, cavitary, destructive pattern. Autoantibodies, Rho and La. So usually in our diagnosis, so once the patient is complaining of, when you think that it could be a test, Skimmer's test is very easy. We have those strips and then we can decide whether it is less than the 5 mm or not in the 5 minutes. That's done. Then when you are in a doubt, send the blood for your anti-Rho and anti-La antibodies. Finish. Another 1 day or 2 days, we will get the profile and then diagnose as a Sjogren's disease. So very simple to diagnose it. But the one thing is very clear, you should understand that the patient could be having a Sjogren's. So what brain doesn't know, eyes will not see. So criteria already I told you. The secondary criteria means he is having other diseases. So what about the treatment aspect? Symptomatic treatment for the dryness of the eyes. Lubricating agents, methyl cellulose, eye drops, maybe 4 to 5 times. Easily available in every shop. Cyclosporin ocular drops. Romixin 16 milligrams TDS has been found to increase the lacrimal secretion. Artificial saliva and the cyclosporin for the xerostomia. Routine dental care, this is the very important. Steam inhalation may help the dryness of the respiratory tract. Candidiasis, So use ketoconazole, etc. Systemic steroids are effective in reducing the parotid swelling when the fellow is having the parotid enlargement. So there is an indication to use the systemic steroids, otherwise not necessary. Hydroxychloroquine as an immunomodulatory drug. Very simple, the treatment of the Sjogren's. Suspect, send the blood for anti-Ro and anti-La and confirm it and give the tear drops, so oxycellulose, and then plenty of the water. And some people, if the parotid enlargement is there, use the steroids, otherwise hydroxychloroquine. Okay, 200 mg or 300 mg, 400 mg depending on the body weight. I think last slide is the best slide. So these are the causes of the dry mouth and causes of the dry eyes. Classification already I told you. Extraglandular features, cutaneous, musculoskeletal, vasculitis, respiratory, renal, peripheral, lymphomas, severe parotid involvement, purpuras. So this is a skimmers test. Sicca, extraglandular, you can use the methotrexate, azathioprine, mycophenolate, morphylate, cyclophosphamide. So thank you very much for your patience here. So that is something about the Sjogren's.